Our second case is a 70-year-old man with hypertension, diabetes, chronic kidney disease, with peripheral vascular disease, status posta right below the knee amputation. He has known three-vessel coronary disease with severe aortic stenosis, an EF of 50 to 55%, and a mean gradient of 33 millimeters of mercury and aortic valve area of 0.8 centimeters squared. He's actually asymptomatic of his coronary disease and severe aortic stenosis, but he's turned down for CABG and SAVR due to the lack of conduits. But he has major vascular surgery planned with a left foot ulcer, so we wanted to evaluate him for his cardiac risk. So here in these two views, we see the left coronary artery system. You see a relatively diffusely diseased LAD that's somewhat small. You have a focal disease on the areocaudal of the left circumflex OM branch. Here we are again, and we can see a relatively focal lesion in the mid OM or mid circumflex artery. In the right coronary artery, you see a relatively diffuse disease of the proximal to mid RCA, as well as a distal lesion, which is somewhat diffuse. Well, we measured with a Verada wire and a Akari guide, and because of the speed of the iFR measurement, we were able to successfully measure all three vessels in about 5 minutes' time. We found that the left circumflex iFR was 0.85, the LAD iFR was 0.65, the left circumflex iFR was 0.85, and the right coronary artery iFR was approximately 0.80. So this was in total 5.5 minutes for a three-vessel iFR, which I think can beat most nuclear stress tests in terms of determining ischemia. We ended up referring him to our outside referral facility for TAVR and multi-vessel PCI, and he received a TAVR, but his three-vessel disease was felt to be too diffuse and not treated at all. And so he still needs vascular surgery, and we brought him back to the cath lab for remeasurement of the hemodynamics and possibly PCI as needed of the highest risk lesions. And when we remeasured the RCA, the iFR was a little better, quite a bit better than before. It is now 0.88, and you can see with both the pullback on the left and the co-registration on the right that much of the distal to mid RCA is ischemia producing, and that surprisingly the angiographic appearing severe mid or proximal to mid lesion is not as significant. Nevertheless, this is a fairly diffuse lesion, and in someone who's asymptomatic, we elected to defer this patient because of the diffuseness of the disease. We thought it was going to be relatively minimally responsive to stenting and would not impact upon his cardiac risk. Interestingly, the FFR was fairly significantly positive at 0.70, but once again, we deferred to the iFR here for diffuse disease, not wanting to fix something that was going to require more than one stent. In the circumflex, we remeasured this lesion, which was, if we recall, iFR borderline at 0.89, and we remeasured the iFR at 0, and we got a value of 0.89 again at the focal lesion in the circumflex OM. The FFR was also borderline positive at 0.79, and once again we just deferred on this lesion, thinking that it was going to be, even though it was going to be easily fixed, we didn't think that this small OM was really going to impact upon his perioperative risk. Finally, we got to the LAD, and his FFR was 0.63 here, so still highly ischemic. The iFR was also fairly ischemic at 0.84, and you can see here the small white dots demonstrate each of the measurements, so it tells you the resolution of the iFR co-registration. And so we have high confidence at where the dots are more frequent that the yellow dot represents an accurate step-up location. And so this is fairly diffuse disease, especially at the ostium and proximal part of the LAD. But the mid to distal part is also significant and contributes. We performed PCI with 2 stents, and we performed post-PCI iFR and improved this to 0.90 with improvement of the FFR overall. So we felt that we had done him some service in converting some of his focal disease, especially ostial focal LAD, to more diffuse disease. And that remains to be seen whether that actually changes his management.